That's it. It's correct. It's yellow.
Thank you very much, Mr. President, my distinguished colleagues. This is a lead debate on a bill to establish the National Nephrology and Kidney Research Center, Hadejia, Jigawa State, and for other matters connected therewith, Bill 2022 SB 385. Mr. President, my distinguished colleagues, permit me to lead the debate on the subject bill which was read for the first time on Tuesday, 10th of March 2020. Mr. President, chronic kidney disease, or CKD, has become a major public health problem in Nigeria, with some estimates putting prevalence at around 20%, or 6% higher than the African average, translating to an estimated 25 million Nigerians suffering from the disease. The figure could be much higher if misdiagnosis and undocumented informal or traditional treatment is taken into consideration. Leading causes include untreated hypertension, diabetes, exposure to certain toxins found in industrial reagents, water contaminated with heavy metals, and runoff from toxins and chemicals found in agricultural inputs. The problem is particularly dire when one considers that Nigeria has one of the worst variables in availability and affordability of dialysis and advanced CKD treatment availability in the world. Over the last 12 years, there is a noticeable escalation of CKD and outright renal failure in the Hadejia area of Jigawa and parts of Yobe, and preliminary studies commissioned by the state government confirmed this about 5 years ago. Outside the usual causative factors, it's very likely that the contamination of groundwater by agricultural pesticides and chemicals following the exponential expansion of rice cultivation is to blame. And the high water table in the region makes the ground and river water, which is the only source of drinking water in the area, particularly susceptible to leaching and runoff. Another study conducted by NARICT, that's the National Research Institute for Chemical Technology Zaria, in 2015, confirmed the abnormally high incidence of CKD in the Hadejia Valley, with a prevalence that is 3 times the national average. The study also confirmed the presence of heavy metals and other environmental toxins in the water supply and in the sample liver of local livestock and poultry. The National Agency for Food, Drugs Administration and Control, NAFDAC, has also reported very high concentrations of cadmium and lead in samples of drinking water from the area, ranging from 0.07 to 0.20 ppm and up to 0.30 ppm for cadmium and lead respectively. Almost all these elements are nephrotoxic in nature. Yet again, in 2021, the Federal University Dutse got a 36 million grant from TED Fund to undertake a research titled Rampant Kidney Disease in Hadejia Valley, Yobe, and Kano states, following the alarming statistics derived from hospital records in Jigawa and environs. Findings from at least 3 of the concluded research projects confirm a CKD incidence that is between 300 to 500% of the national average. And there is no dedicated renal center in both Jigawa and Yobe states, although there are dialysis facilities in the federal medical centers and some general hospitals that are absolutely overwhelmed by renal patients. CKD sufferers are therefore forced to go to Kano, where the situation is also dire, with instances of only 8 out of 20 dialysis machines working in AKTH and 4 out of 6 in Wase Hospital, leaving only private facilities where the unsubsidized cost is almost 5 times that of the government hospitals. The Jigawa and Yobe state governments offer free dialysis in government hospitals, and there is even a donor-founded dialysis center in Hadejia that heavily subsidizes the procedure, but the waiting list can stretch to months because of the deluge of patients. The scenario renders dialysis for more than 2 weeks unaffordable for 96% of RRT patients, and the NHIS doesn't presently cover the procedure, which can cost as much as 300,000 naira a month without cost of drugs. So a diagnosis of end-stage renal disease is as good as a death sentence for anyone diagnosed with end-stage renal failure in these areas. Mr. President, my distinguished colleagues, this is why the siting of a kidney research and treatment center in Hadejia becomes imperative. There is an urgent need to locate a center of excellence dedicated to establishing the causative factors and treatment options in the renal disease epicenter of Nigeria for the benefit of kidney disease patients nationwide. The interest generated by concerned experts in the field and the preliminary results of the various investigative and research endeavors justifies the urgent call for the involvement of the federal government to intervene in halting an endemic situation and save thousands of lives lost to an otherwise avoidable or manageable medical problem. The center, as envisaged, will not only focus on identifying and dealing with the causative factors, but indeed address the issue of affordable treatment regimens through early diagnosis, treatment, and management before the prognosis becomes end stage with dialysis or transplantation as the only options. Kidney disease is treatable and reversible if identified at an early stage, but the absence of nephrologists, dialysis nurses, and specialized equipment, as well as adoption of preventive measures and a novel treatment approach that only a dedicated center can provide, means certain death for a majority of the patients in the epicenter of the CKD pandemic. In line with Order 76.3 of our standing orders, the financial compendium of this bill is hereby attached. I urge my colleagues to support this bill so that kidney disease in Nigeria can finally get some focused federal attention in line with the global best practice approach to renal disease. Thank you very much, Mr. President.
Thank you very much. Distinguished Senator Sadiq Suleiman Umar.
Colleagues, I am Sadiq Suleiman Umar. I represent the good and decent people of Kwara North and Waa. Mr. President, my distinguished colleagues, I rise to second that this bill be read for the second time for the obvious reasons stated in this lead debate. And in this, Mr. President, my distinguished colleagues, kidney disease is a very serious matter in this country. And from the statistics, it will interest you to know that we are merely 109 here. And going by that statistics, and if you do a test, you will be shocked. And that's the reality in the country today. As the lead debate states, Hadejia and Yobe states came up as a very, very epicenter for this disease. Therefore, establishing a kidney center that will carry out research that will not only focus on treatment, but on prevention, which is key in modern medicine today, will not only help this area that are most affected, but we have the whole country, where people, we have data, information, and guidance for prevention and for treatment. Therefore, Mr. President, I urge us all to support this bill to be read for the second time. Thank you for the opportunity.
Is there anybody against the bill?
Mr. President, thank you for calling me. My name is Ibrahim Ayolori Egbe. I represent Kwara Central Senatorial District. Mr. President, I rise to support that the bill be read second time and to commend my colleague Senator Ibrahim Hadejia for proposing this bill. The statistics presented in his lead debate are very compelling. Mr. President, we have samples of similar specialized hospitals across the country that deal specifically with diseases that are special. We have national hair centers. We have specific hospitals for vaginal fistula based on the specialties and based on the fact that they are required. So therefore, Mr. President, this is very essential and necessary, particularly for this area. But I want us to look, if you have resources, we need to spread such specialized hospitals across the country. Nigeria is a vast country. And I know if we have this center in only Hadejia area, it will attract patients from across the country, but there will also be challenge of movement and people going there. So if we do, during the second stage, during the public hearing of the bill, we may consider looking at having it, at least to start with, across the two regions of the country, north and south, because kidney disease, just as said by my colleague Senator Sadiq, is a common disease, particularly given the life-changing style that we're having and the chemicals that we are consuming. Mr. President, finally, on the lighter mood, nephrology and kidney is the same thing. So I'm sure at the consideration, we will adjust the name. Nephrology is special, the Latin word for kidney. So we use one word. It will be either a National Nephrology Center or National Kidney Center. I therefore support that the bill be read second time. Thank you, Mr. President.
Those in favor that this